fracture of the scaphoid bone, which is one of these 8 little bones that constitute the carpal bones of the wrist. On this diagram, the scaphoid is marked number 1. We study the little boat-shaped scaphoid bone because it's the most commonly fractured carpal bone. We need to know where the so-called anatomical snuff box is here on the thumb side, which because of anatomical position we also call lateral. While early x-ray can miss scaphoid fracture, we can lean on physical exam with the more sensitive snuff box tenderness test to try to diagnose scaphoid fracture. The last key item is that the scaphoid fracture complications of avascular necrosis and non-union are more common at the proximal pole because of how the blood supply gets there. It has a retrograde flow. There are 8 carpal bones, and one is called the scaphoid because someone thought of it as shaped like a boat. If someone is said to have a scaphoid abdomen, that's the opposite of distended. Rather than having a distended convex contour, a scaphoid abdomen presents a concave contour as the anterior abdominal wall is sunken. But back to the scaphoid bone. It is the most commonly fractured carpal bone. If someone falls forward and stretches their hand out in front of them to try to stop from hitting their face on the ground, this is one way to fracture the scaphoid bone. The acronym they like for this is FOOSH, which is short for fall on outstretched hand. If the scaphoid fractures, it can be occult. And here we don't mean something mystical, although in a sense it is mysterious because it's hidden or not readily discernible. As far as medical use of the word occult, for example, FOBT stands for fecal occult blood test. The idea there could be blood in the stool or feces, and that sounds scary. And yes, broadly speaking, it could mean bright red blood per rectum, easily visible in the toilet. A fecal occult blood test is saying we need to use special tools to investigate more closely because even though we don't see with the naked eye the blood, it might be sort of hiding. By the way, FOBT is one way to screen for colorectal cancer, which I guess in both men and women is the 3rd most common cancer by incidence and also by mortality. Also, they've moved the suggested starting age of screening from 50 years old. So USPSTF, that is the U.S. Preventive Services Task Force, they've pulled it back to 45 years old as the age at which you should start to go get your first screening test. Okay, again, back to scaphoid fracture. It can be an occult fracture, hidden, and thus it might not be seen on the initial x-ray. There's this term anatomical snuff box. If you want, you can try to look up why they called it a snuff box. I'm pretty sure it has something to do with tobacco. A patient with pain localized to the anatomical snuff box is most likely to have a fracture of the scaphoid as the cause of that localized pain. That should give you a sense of how proximal the scaphoid bone's location is. Now, what is necrosis again? It's the sloppy kind of cell death that involves inflammation. And what would avascular mean? Something about lack of blood vessels. Now, bone doesn't just consist of minerals, there's also a bunch of living cells. At some point, you have to know quite a bit about avascular necrosis of the femoral head. Another way to refer to the same situation is osteonecrosis of the femoral head. So osteonecrosis means the same thing as avascular necrosis of bone. For now, we're talking about avascular necrosis of the scaphoid bone. Somehow the blood flow got messed up, and we need to know this can happen with fracture. Which bone is called the radius? It's this one, which goes to that same lateral side of the hand as where the thenar group is located, and the anatomical snuff box, and also the scaphoid bone. So the radial artery travels on this side, and it's a branch of the radial artery that feeds the scaphoid. But it supplies the scaphoid in a retrograde fashion. That is, the branch runs distal and then turns around, returning proximal to feed the scaphoid. This retrograde blood supply can help make sense out of the complications being worse or more likely the more proximal on the scaphoid we are. Whenever the supply comes from one direction only, the most vulnerable parts are the parts farthest down the road the blood supply travels. In most cases, flow of oxygenated blood is anterograde, proximal to distal. So the distal part of the organ is most likely to suffer when there's ischemia for whatever reason. In this case, the flow of oxygenated blood is retrograde from distal to proximal. So if a fracture happens, it's the proximal scaphoid that is most likely to suffer the complication of avascular necrosis. In addition, healing such a fracture, actually bringing back together the pieces that broke apart, that is, fracture union, this might not end up happening. That's what we mean when we say fracture non-union. Fracture union has a few stages, involves cytokines, fibroblasts, but to put it simply, any healing requires good blood supply. So proximal scaphoid fracture is more likely to be complicated by non-union in addition to avascular necrosis. Okay, let's tie it all up. The scaphoid bone is the most commonly fractured of the 8 carpal bones. Mechanism of injury is often a fall on an outstretched hand. Occult fracture can be missed on initial x-ray. And the scaphoid bone is palpable in the anatomical snuff box. Proximal scaphoid fracture may entail complications such as avascular necrosis of the bone or non-union of the fracture. These are due to the travel of the blood supply, which is carried by a branch of the radial artery in retrograde fashion. Okay, that's it for this one.